Hi there. My name is Steve Dunlop, and I'm an assistant professor of emergency medicine at Hennepin County Medical Center, as well as at the University of Minnesota. But more germane to this talk is the fact that I'm the medical director at COPI and have been working in sub-Saharan East Africa for over a decade. I was one of the original attending physicians at Muhimbili University in Dar es Salaam when they started their emergency medicine residency training program, which was the first emergency medicine residency in sub-Saharan Africa outside of South Africa, and things have changed in that decade. My family and I have been living and working in Arusha for over a decade, and that's how this partnership started. And of course, we could get more into those details, but I was asked to give a little bit of background information on trauma and the importance of pre-hospital care and how that pre-hospital care is important for all disease processes, especially as we think about development of healthcare systems across Tanzania, including both our urban and our rural environments. So I'm going to try and keep this quick. I'm going to speak very fast, so I apologize for that, but here we go. So if we talk about the timely care for the injured, of course, it goes from the point here in the upper left where we have the injury to thinking about ambulance services to thinking about the healthcare sector, et cetera. And so it's a very complex system. Why do we need this? Well, these are numbers that I think people focus on a lot. Here we have HIV deaths, the red man, it's just under 1 million per year. TB deaths are about 1.6 million in the world. Malaria is just under 500,000 deaths in the world. And then the NTDs, or neglected tropical diseases, make up a little under 200,000 deaths per year. What about injuries? Injuries make up just under 6 million trauma deaths, and that was in 2014. So obviously we know that this data is old and that number is a little bit closer to 7 million deaths that we're seeing. So the point here is that you can add the number of deaths from HIV, TB, malaria, and all the neglected tropical diseases together, and it's fewer than the number of trauma deaths in the world. And that's why we need to focus on it. Here's a slide from the WHO showing again the little small HIV, TB, malaria combined man versus injury. But when we think about where the investment is happening, 36% of all developmental assistance is for healthcare is headed towards those three disease entities. Whereas we see only 1% or less than 1%, I can move my little box there, less than 1% for trauma care. And this is why it's important that funders like you focus on things like injury prevention and pre-hospital care, because nobody else is really focusing on it from a financial perspective. So where are these injuries happening? By far and away, the biggest contributor is road traffic injuries here. So it's about 30%, and it's the biggest piece of that pie. And what I can tell you is that all the research coming out of sub-Saharan East Africa is showing increases in road traffic deaths by 10 to 20% per year. There is no other disease process that I can think of that grows at that rate. And this is due to a lot of things. Lack of infrastructure and urbanization of populations are the two biggest of them. But there are a lot of other things. The other thing that I want to draw your attention to is look on the left-hand side, that gray where we see suicide at 16% of this 6 million deaths. So the second biggest contributor as a single pie entity is suicide. And so if ever you were wondering about sort of an objective, concrete example of the burden of mental health in the developing world, look at the number of suicides, 16%, and that's massive. And this is where the idea is born between the intersection of us doing both our emergency healthcare while weaving mental health training and treatment, honestly, for our pre-hospital providers and for our first line workers, because it is an extremely undue burden that they suffer. So where does this happen? Of course, it happens on the street. We know this. It happens at the home. It happens at school. It happens in seas, lakes, especially when we're thinking about pediatrics, drownings as a high level, workplace, etc. Road traffic injuries alone are around 1.4 million deaths per year, and actually that number's old. It's going up quite a bit. But the thing that's important to see is that the fatality of those injuries in low-income countries is triple of what it is in high-income countries. And so when we look at that disease burden, and we also think about the fact that it's the leading cause of death for those aged 5 to 29, and in a country like Tanzania, where the median age is 14, this disease process is falling squarely on the majority of the population that is Tanzania and sub-Saharan Africa. And that's why it's really important that we focus on it and not ignore it. And thankfully, the WHO has made multiple mandates. You can see here through the various World Health Assemblies looking at the evolution of emergency care systems becoming a universal health coverage and a right, and having timely care for acute and injured. And so this is now not hiding in the shadows as it was 10 years ago where no one was really looking at it. There is a mandate, but there isn't a ton of funding yet, and there isn't a ton of implementation, certainly not at the rural level and certainly not at the pre-hospital level. And so the WHO has come up with their emergency care system framework where we can see all the way from the scene down here in the lower left, where an ambulance might respond, which requires a bystander to call 911 or whatever, the dispatch center. You need a dispatch center and a system. They need ambulance that has staffed with stuff and people that know what they're doing. And ultimately, they need to go to a location that can handle these folks, right? And the majority of the interventions, rightfully so, myself included, have focused on hospital care, right? It doesn't make too much sense to have a system to bring people to a hospital that can't care for these folks. That said, there is some focus at that level. There is, however, very little focus on the pre-hospital side, which is extremely important. And so in this continuum of care, of course, there's the bystanders, what we think about, and even the WHO is listing here, training for drivers and police is high impact. And that's what we're talking about with COPI. Of course, the pre-hospital, hospital, and rehabilitation portions of this continuum are also extremely valuable. But why is this important? Because it helps avoid the high costs of early death, which is a big contributor to loss, complications that occur because of delayed care, prolonged recovery, and preventable death. Ultimately, this leads to lost wages and productivity for society. And we hate to put things into dollar and cents because we care about people, but ultimately, no money, no mission. So let's look at this. How much does it cost to have an ambulance? I think it's often thought of as being extremely expensive. Well, let's put it into perspective. A staff community rural ambulance is just under $300 per life gained, life year gained. A staff community ambulance in an urban is less than $100, but look at this, trained lay first responders and paramedics, $7 per cost per life year gained. And put that in contrast to thinking about HIV and antiretrovirals in care, it's about $1,000. It depends on who you're looking at. I've seen rates up to $1,500. And this isn't disparaging HIV or saying that we shouldn't be treating it. I 100% think that we should. But I also think it gives us some perspective to see how cost effective having even simple interventions like trained lay first responders and paramedics can be. So the WHO, of course, has their sustainable development goals. 3.6 and 3.8 are talking about decreasing road traffic accident numbers and talking about access to healthcare coverage. And this is extremely important. So I'm just showing you that it isn't just us talking about it, but it's also important to understand that setting yourself up with a pre-hospital system that can deal with the acutely injured happens to also help you with 10 other SDG targets by addressing things like non-communicable diseases, obstetrics, child health, disasters, and violence. Of course, we can all see how having a pre-hospital cadre of folks can deal with, in a horizontal fashion, a multitude of different disease processes. The impact of this care: over half of the deaths and a third of the disability in low and middle income countries are from conditions that are treatable by emergency care. And this is what we're talking about. So when we think of COPI and what it's really thinking about is this left half here, what's within that square where we're talking about pre-hospital providers, ambulance care, and the development of those strategies. And that's where COPI will shine. COPI, as you can have heard, I'm sure, and seen on the website, is dedicated to the intersection of education, emergency medical services, mental health, and forming long-term partnerships. That's Peter Mabula. He's one of my best friends in the world, and he is now the head of department at Arusha Lutheran Medical Center. And he and I have been working together for that decade, creating the sustainable platform for emergency services in northern Tanzania. And I would love it if you guys were able to join us in that effort. And with that, I'll stop. Of course, I'm always happy to talk to anybody at any time about anything. Take care.